Hello, good afternoon, everyone. On behalf of Cross Culture Church of Christ, I want to extend a very warm welcome to all of you who have joined us online for this webinar. My name is Weedy. I'm a member of Cross Culture Church, and I also serve in the Caring Together ministry team. This webinar is organized by the Caring Together ministry, and the aim of our ministry is to nurture and grow our understanding, care and love for one another, as commanded by our Lord Jesus Christ, to love our neighbors as ourselves. In March, we did one event on anxiety, but today, the focus will be on aging and caring well with understanding. Now, there are many quotes about aging, and there's one I like by Mark Twain. He said, "Age is an issue of mind over matter. If you don't mind, it doesn't matter." Now, I wonder how many of you agree with this saying in this webinar room. And I wonder, what are your thoughts when you think about aging? In a while, I'm going to invite all of you to take part in an online poll. You will see the question come out on your screen, and you can click on the answer of your choice. There'll be 5 questions, and I'll give you about 5 seconds to answer each of them. Your answers should be spontaneous, and don't worry, we won't know who you are, but your answers will contribute to the results, which we can all view together. So, are you ready? Okay, let's begin. Let's bring on the first question. Now, what age group are you? This is a question of fact. Should be very quick, don't have to think. So 5, 4, 3, 2, 1, done. Let's see the results. Okay. That's good. We have a fair representation of different age group, including the younger ones. That's good. Second question. Age is just a number. Agree or disagree? 5, 4, 3, 2, 1. Done. Let's see the results. Okay, we have a lot of optimists in this room. That's good. Let's see the third question. When do you think the body begins to age physiologically? 5, 4, 3, 2, 1. Done. Okay. We've got different mixed response here. Okay, fourth question. At what age do you consider a person to be elderly? In other words, how old is old? 5, 4, 3, 2, 1. Wow. Yeah. I wish I know the age group that represents the answers, behind the answers here. And I think this is kind of relative. I remember when I was younger, anyone above 40 is old. But now I've raised the bar a lot higher. Let's have the last question. Generally, what is your attitude on the inevitability of getting older? 5, 4, 3, 2, 1. Can we have the results? Wanting to know more and prepare. Okay, we've got a lot of response in that one. So good, you're in the right place today. So you can see that the poll results actually show us that we all have a different perspective towards aging. Later on, we shall hear from our experts, and we can confirm our understanding, or we can correct our misunderstanding. Now, let me now show you the outline for today's program and also introduce our speakers. We have lined up a panel of speakers, all of whom are members of Cross Culture Church, and they are also medical and health professionals with years of experience caring for the elderly. Each speaker will focus on a different aspect of our topic today. Our first speaker is Dr. Chong, and he will present to us on facts and misconceptions on aging. After nearly 40 years of practice, including 33 years as a geriatrician in aged care, Dr. Chong retired from full-time work in February this year. He's now practicing part-time. Dr. Chong is also actively serving in our church missions committee. He's married to Lainor and they have 2 adult children. Our second speaker is Dr. Melvin Yong, and he will speak on the topic, what is normal aging? Melvin worked as a geriatrician with a special interest in wound management and medical education. He also teaches at the University of Melbourne. Melvin also served as a ministry leader for Cultivate, which is our young adult ministry in our church. Next, we have Jean Wong. She will share with us on how physical exercise can help with aging. Jean is a qualified physiotherapist, currently working in aged care and loving it. Jean is also involved in our church creative ministry. After Jean's presentation, Dr. Chong will return and he will share with us about aging with understanding and purpose from the biblical perspective. It will be interesting for us to learn what scripture has to say about aging. Our final speaker on our panel is Dr. May Law, and she will focus her presentation on caring for the carer, which includes help and services, as well as resources that are available in Australia. May works in a public hospital network as a consultant geriatrician. She is also part of a private geriatrician group practice. May is married to Clarence and they have 2 young daughters. At the end of this presentation, we'll have a time of Q&A facilitated by my co-worker Lucine. You will find a Q&A icon at the bottom of your screen, and you can type in your questions anytime during this webinar. Now, I hope you're all looking forward to hearing from our speakers and to learn from their knowledge and experience. Let us ask God to bless our time together. Please join me in prayer. Heavenly Father, we thank you for enabling us to organize this webinar. Thank you for each of our speakers and for the preparation that they have done. We pray that you will use their knowledge and experience to teach us how we can care for ourselves and also to equip us to be better carers for others. Lord, there might be some of us who are going through challenges as we get older or facing challenges as a carer, caring for our loved ones. Please renew our strength and give us a fresh understanding of how we can age well and to support others. I pray that we will all experience the joy in every season of our life that comes from knowing you. We commit our time to you and ask that you will help us to apply what we are about to learn. In Jesus' name we pray. Amen. I'll now invite Dr. Chong to share his presentation.
Thank you, Huidi. The outline of the part 1 of my talk is what does a geriatrician do and what's the definition of aging, and Australia being an aging nation, and the society's attitude to the elderly. And in part 2, I will share on aging well with understanding and purpose. Okay, what does a geriatrician do? A geriatrician do many things. Firstly, he's involved in assessment of elderly in the community, hospital, clinics, and more recently on telehealth. The geriatrician also assesses the needs for rehabilitation, care packages, and residential care. He's involved in teaching, like in journal club and conferences. And also, in summary, a geriatrician sees the big picture. He's one of an important member of a team who works with other specialists and allied health professionals. So the definition of elderly, according to the World Health Organization, is for people aged 65 or above. Is considered. There are the definition for most developed nations. For underdeveloped nations like Zambia, the average lifespan is 63.7 years. So the WHO for developed nations is 65 plus. I'm 66, I don't feel old. So for those between 65 to 74, it's considered as a young old. 75 to 84 is old. And 85 years plus, it's called the oldest old. So the Australia's population is aging. And if you look at the 2 graphs, that over a 20-year period between 87 and 2007, you would, now this is the male and female percentages in the different age group. you would have noticed after the age of 40, you would find there are more people in that age group over a 20-year period. And this is the latest figure between 1999 and 2019. You again, male and female in the different age group, but you find it over the 55 years above, there are more people between 1999 and 2019. And then you find after the age of 75 years onwards, there are more female than male. That's because female generally live a few years longer than male. Why is Australia's population aging? There are two reasons. One is the falling birth rates, and then second reason is increasing life expectancy. So this is the Australia historical projected fertility rate. It means for women of childbearing age and average how many children they have. This is from 1947 and projected for the next 100 years. You would find that if you're 55 years and above, you find that there's a high fertility rate after the Second World War till about 1965. This period is a baby boomer. So if you're age 55 and over, you're a baby boomer. And after, in the late 1960s, the birth rate fall quite dramatically. People are having less and less children. And while in the baby boomer area is 3 onwards, but it's 4. And over this period, you would have this period from 65 to 75 as Generation X, 1975 to 1990, Generation Y, and some people refer this as a yuppie era, actually, where a lot of people double income, no kids. And secondly, we are living longer. In 1960, the life expectancy for male at birth in Australia is around 68 years. Today, it is about 85.8 years. And the projected figure in 2040 is around 88.3 years. And if you are 65 on January the 14th, for a male, you have about 20.5 years of average life expectancy. For female, is about 87.9. And the projected figure in 2030, you would notice the figure actually increases over the next 20 years. And this data is talking about the longest living elderly in the whole world. A bit surprising, but the male and female in Hong Kong at this moment is the longest living life expectancy. On Australia is number 8. If you look at the top 8 countries, 5 of them are in Asia Pacific. And you recently, because of the COVID-19, you know that there are a lot of elderly in Italy and Spain. Now, should we be concerned that the population in Australia is aging? The answer is yes, because there'll be many more older Australians than there are today. So in 2002, the number of Australians over age 65 is 2.5 million. In another 22 years' time, it will increase to 6.2 million in terms of percentage of population, from 13% and double over a 40-year period. And for especially those in 85 plus, this is a group that will have the highest growth in numbers. So in 2002, there are 300,000 of them. And in 2042, it'll be 1.1 million. And in terms of looking at workforce, in 2002, there are about 5 people in working age between the age of 15 to 64 to support every person age over 65. But in 2042, that number is going to reduce to 2.5 people. In other countries of the world, again, those people, elderly, over 65, will increase from 3% in 1972 to 20% in 30 years' time. In the USA, this year there are 56 million. In 30 years' time, there will be 80 million. So on a global scale, the number of people older person is growing faster than the number of people of any other age group. If you look, it'll be in 2020 now, and this is the figure, the proportion-wise in 30 years' time. So what is aging? Aging can be defined as an increasing frailty of an organism. With time, that reduces the ability to deal with stress, resulting in increased chance of disease and death. And frailty is a clinical recognizable state of increased vulnerability resulting from age-associated decline in function across multiple physiological systems, and the ability to cope with everyday or acute stresses is comprised. So some characteristics of aging is unintentional weight loss, weakness, exhaustion, slowness, and low physical activity. If anyone have 3 or more of these, they will be considered as frail, and 1 or 2 is considered as pre-frail. There are a lot of clinical frailty scale, and this is one example by Dalhousie University, and you can find it on the internet. So let's look at a couple who is aging successfully. So if you look at Queen Elizabeth II and Prince Philip, the Duke of Edinburgh, Prince Philip is about 5 years senior than Queen Elizabeth. So when Queen Elizabeth is 21 and he's 26, she's 81 and she's 86. In 2017, she's 91 and he is 96. So between those 10 years, at the age of 81, the Queen and Prince Philip will look quite well for their age. But over the 10 years, you notice they look frail. And Prince Philip is now 99. He has been in hospital twice, as far as I know. And the Queen is 94, and she still looks reasonably well. So what's the perception in the elderly today? If you look at that, they value primarily in terms of economics. Old age easily seen as lack of productivity, or if you like, past the use by date. And pension scheme can become a threat for many companies and to government. And over the years, we've gradually seen many institutions, instead of providing a service, profit become a priority. And there is discrimination among the elderly. We see a dichotomy about aging. On one hand, there is a decline from the best in life. It is a demographic problem. It is a drain on the economy, and they can overwhelm the health system. In fact, those 85 plus use up a lot of cost in terms of healthcare. But on the other hand, it is a time of maturity and wisdom. It is a release from stress of working life, self-fulfillment, serenity, and an opportunity to hand over power and knowledge to the next generation. There are 3 stages of aging. One is the active phase following retirement, usually from mid-60s to about 80s. And these are commonly referred as the golden years. And there's a weakening stage where there's increased need for care, usually until the 80s, and institutional care may be needed. And there is an end of life care where overwhelming care needs. So is age just a number? Well, age to some people can be a sensitive thing. They don't like people don't know. And also, a lot of people spend a lot of money trying to keep their age a secret. So we're going to watch a short 1-minute video clip. Is age a number? If you're 55 plus, you would notice some of the actresses that's being mentioned.
Actresses, and in one picture they're 21 and in the other picture they're 78. And we begin with the Italian representative, Sophia Loren. So here she is, 21 and 78. And she's now actually 81. She's still acting. She was in a film directed by her son just last year. So I think a great example of aging successfully and healthily. Now we move to the French representative. This is Brigitte Bardot, 21 on the right and 78 on the left. And Brigitte is now also 81. She was born just a couple of weeks after Sophia. And she might have got a few more wrinkles, but actually she's still very active. She's politically active. And so I think another great example of what old age can be like. Now we move on to the British representative. This is Elizabeth Taylor, 21 on the left and 78 on the right. And Liz never made it to her 79th birthday. She passed away just a few months after this photo was taken. And she spent really the last years of her life wheelchair bound, really not a successful old age. So longevity is variable and your old age is variable. And here's some of the data on life expectancy. So female life expectancy increasing, and it's increasing at 2 years per day.
Right, thank you, Dr. Chong. Oh, no.
So age is not just a number, and longevity is variable, and old age is very variable. And there is a considerable difference between chronological age and biological age. Chronological age is from the year you were born. Biological age is how you look. Now, when I was 22 and studying in university, every time I have a haircut, the tram conductor will ask me, full fare or half fare? Half fare is 14 years and under. So when I'm in my late 30s, some overseas student asked me what course I'm studying. So last week, Facebook tells me I look 39, and my reply is, you can't be serious. So this is the end of my part 1 talk, and next we will have Dr. Melvin Wong. Yong will speak to us.
Well, thank you, Dr. Chong. Take 2, I suppose. Anyway, thank you for I guess the beginning, and also thank you for the opportunity to speak. And might probably start by trying to get this moving. And yes, it finally did. Thought I'll start with the Bible verse, and this is from Ecclesiastes, and this is my favorite verse of the Bible, and pretty much quite a guiding verse for not just my work, but just how I see the passage of life as well. And if anything, the passage of life should probably draw us closer to God rather than away. But I'm not here to talk about philosophy. I mean, we can if you want to, but we are here to talk about what is considered normal aging. And just as Dr. Chong mentioned, there is a few sort of ways to sort of think about what age is. As is mentioned, there is chronological age, based on the year you're born and the numbers that follow it. And then there's also biological age, which is physiological age, and that's what I'll be concentrating on today. And then there's also psychological age. How old do you think you are? How old do you feel? And then there's, of course, what is perceived by society to be old as well. Now, it's obviously quite a big topic to cover in 15 minutes. So I hope that will cover some parts of what is expected with physiological aging. And I hope that, with the other speakers, as well as the Q&A after that, we can probably cover some others as well. But the other disclaimer is also that it's true that everyone is different, thanks to different upbringing, different personal health and other circumstances as well. But these are some of the very common things about aging and some of the changes and problems that we might encounter with it. So on to the bad news. So some of the probably the more obvious sort of changes that we can see is probably on the skin. It becomes less elastic, hence the wrinkles. It does become drier and thinner, so it's easier to tear, to bruise, or to wound. And then there's also, what we see in the eyes as well. We get thickening of the lenses. Hence, as for those of us who don't wear glasses from when we were born, from a young age, it's pretty much quite normal to need glasses as we age as well. Not to mention, there's also other changes to the eyes where it becomes more difficult to see at night and to see differences between color as well. Hence, driving does become quite a big issue as we get older too. I guess the other thing that's also quite obvious from what we see in other people is also about hearing. It is quite normal that higher frequencies get lost, and that might mean the need for hearing aids for some people. Wait, there's more. Bones and muscles is going to be another major thing that also changes with age. First and foremost, when it comes to bones, for example, our bone mass decreases pretty much by the end of our teenage years, so probably by in the 20s, and certainly with growing age and more so in women after menopause and losing the protective effects of estrogen, there's a higher risk of osteoporosis, so bones which are easy to break, and hence a higher risk of fractures should there be some cause for it to happen. The other thing is also about muscle and body mass. There's changes. You get less muscle composition and then higher body fat content. Again, more so pronounced in women after menopause and changes of hormones. And hence, there's probably enough observations about changes with age, and this is one of the reasons why. And the other thing which is also very important is the fact that as we get older, the way our muscle, I suppose, compensates or change, especially when it's not active, becomes quite different. And that's this whole concept of sarcopenia that's mentioned there. And that's more so in the cases of when you are inactive. For example, if let's say you were sick and you were bedridden or you end up in hospital, your muscle quality can really decrease quite quickly with that. And we're talking about a matter of days, not just weeks or months. Another thing which is also quite obvious is changes to your sleeping pattern, albeit, of course, this is also partly to do with your work and other life circumstances, but it is actually quite normal to actually need less sleep as we get older. And hence, people wake up earlier and they, as a result, they also might also go to bed earlier. Fragmentation during your sleep time is common, and so sometimes the need to nap becomes, I suppose, higher with age as well. I'm sure some of you might be quite familiar with your children always wanting to stay up late and to wake up late, but it's actually quite normal just from a sleep physiology perspective that as when you're younger, your body clock's kind of like this way and it sort of shifts to go follow the clock as you get older. And of course, the other thing is that with our cardiovascular system, our arteries are more stiff and hence hypertension or high blood pressure is more common. The walls of the heart is stiffer, your maximum heart rate is lower, and hence your ability of your heart to cope with what your body is doing is less. And so it might lead you to feel a bit more tired than usual. And then, of course, there's many other things. The brain is also important, and it is true that we do lose cells as we get older. Our reaction times are certainly slower as well. From a hormones perspective, I've mentioned about menopause, but there's also for us guys, also andropause, which is the drop in testosterone levels and its associated complications. And then there's also the body's inability or increasing resistance to insulin in dealing with glucose. And so there's a higher risk of diabetes. And the list goes on. And we can probably go on for ages about it. And hence, because of that, there's some very specific kind of problems that we do see in geriatric medicine. And this is both, I suppose, the beauty and also the challenge of what we do as geriatricians. We know that many things change with age, and that each individual introduce their own variation to it. And that's where we come in to help in that sense. I think the first major one, which I'll probably talk about, is going to be about memory, about cognitive impairment. And I'll probably start by saying that memory loss is not inevitable with aging. Now, some of you, I know, might be quite surprised to hear this, but I probably just want to challenge that notion a bit. I mean, it is true that with all the changes in the brain that I've mentioned earlier, that our thinking and memorizing speed is slower. And that learning is also a bit slower, and that our ability to retrieve memory that's already been formed is slower as well. But this can be helped by things like prompts, cues, and other things that we use as aids to help our memory. So the kind of memory that you are expected to remember, things that I would remember, that you and I would remember at 20 or 30, don't just normally disappear when you get to your older age. When they do disappear, that's where the problem is. So I probably would challenge the notion that that it's memory loss is just a normal thing in aging. It's actually not. The other thing which I also probably want to remind you is also the overlay of mental health, and the effects of poor mental health, if it's not looked after, can also impact a lot on how your brain functions too. I probably won't go on too much about this, and I'm probably quite confident that some questions will be asked about dementia. I'll mention the top two types of dementia that we encounter globally, and of course the first one will be Alzheimer's dementia, which is still the most common form of dementia, and it's very characteristic short-term memory loss. How I would often picture it to patients and their families is that imagine that you've got a glass that's just totally filled with water, and you try to add more water to it and it just drips off the side. That's an analogy of how Alzheimer's dementia is. You just really can't add any more new memory onto it, and it just slips off out of the cup. And of course, as Alzheimer's gets worse, your cup becomes smaller, the amount of memory that you have within it becomes smaller and smaller, and then it progresses to its final form, which ultimately is terminal. The other top cause of dementia is what we would call vascular dementia, which is quite a broad term actually for problems with blood circulation in the brain. And as you can see with the images of the brain on the left side, it looks like there's problems with the connections within the brain itself. Now, the risk factors for this is the same for heart disease. So things like diabetes, high blood pressure, cholesterol, smoking. Again, many things that can be done about it, and hence early prevention for this is works the best for it. In fact, most of the research talks about best time to prevent these forms of dementia or effects of this type of cognitive impairment is probably in your middle ages, so your 40s and 50s, for example. Now, another kind of common thing that we often see with in geriatric medicine and in aging is about falling or falls. Now, although it's common, but it is abnormal. And it carries a lot of problems in the sense that there's obviously the risk of major injury, like a fracture, and that can lay someone low for a long time. But there's also about the fear of falling and its effect on psychology of someone who's having falls. They are more inclined to not do much, to not go out of the house, and that carries a lot of other problems along with it as well. Now, falls is not just about the injury that's sustained or why it happened at that time. There's often multiple causes and risk factors for it. So I think just in short, what I'll say is that when someone is frequently falling, it's just probably the tip of the iceberg. And it's more, it's a warning sign in a sense. And there's much that we can do about it. And it's more than just using a gait aid, more than just using a walking stick. Because even a trip is, unless you've been tackled down by a big rugby player that's out to get you, it's not just purely accidental. You have to ask yourself, why did you miss that step? Why were you not able to break yourself from falling? So there's a lot of questions that actually go into it. Now, the last, but again, not the least, in terms of all the major issues that is in geriatric medicine, which is quite dear to my heart, and I probably would like to bring it out here, is about the issue about incontinence. Now, it's actually very common, but the thing is that no one actually talks about it. And it, again, as how I've been sort of talking about for the past few minutes, is something to be challenged, that it is a myth that leaking is inevitable with age, which is obviously not. And again, there's much that can be done about it. And that containment, so the use of continence aids, nappies and things like that, is not the only solution. And so we come to the good news. This is a diagram which I really like when it talks about what successful aging is. It's the ability to engage with life, to have an active mind, active body, and at the same time to follow sound health-related advice with regards to your personal circumstances and health. So what is healthy aging to you, I might ask? Is it how long you're going to live? Is it how well do you live? Quality of life being the term for that. Is it about, to be feeling healthy, having good well-being and physical function? Or is it, being able to engage in social networks and activity? Or a mixture of all the above as well? So I suppose I might leave you with the thought that, what you see here in this sort of little graph from childhood to elderly age, does it always have to happen that way? I mean, I asked this question, not just to myself, but even to my parents as well. But you have made plans for yourself and your family all these years, so why not make plans for your later years? Anyway, I'll stop there, and I'll pass over the time to Jean.
Hi, good afternoon, everyone. So thank you, Melvin. So I'll be sharing a bit about exercise and aging. We'll be covering, whoops, let me try to control this. So we'll be covering some misconceptions of exercise and aging, the benefits of exercise, and overcoming some barriers. We'll also be watching a short video later on some simple and safe exercises that can be done at home. So let's start. This is what I commonly hear people say. I exercise for half an hour each day, so it's okay to be a couch potato the rest of the time. I'm 75 years old and have never exercised. It's too late to start. And here's another one. It's not safe for people with Alzheimer's disease to exercise. I'm not fit enough to attend an exercise class. And avoiding activity is the best way to prevent falling. Of course, this is untrue, and hopefully we'll cover this as we go. So why exercise? Why bother? So firstly, exercise boosts our immune system and helps prevent diseases. Those who exercise typically sleep better, maintaining a good immune system. Exercise also works on muscles to produce hormones that assist with the immune system. They help find the infection and also make sure that the inflammation doesn't get out of hand. And this is helpful to fight off viruses. Also, studies have shown that exercises prevent and slow down common diseases such as heart disease, stroke, and diabetes. Secondly, exercise helps mobility and functionality. In terms of strength, muscle weakness is a major health problem for older people, and it is associated with osteoporosis and an increased risk of falls and fractures, like what Dr. Melvin was sharing before. Strengthening exercises is important to combat this and also helps the body to be strong enough to perform everyday activities. Exercises also improves endurance. Many studies have shown that aerobic exercises can improve stamina and endurance for older adults. These are exercises that increase our breathing and our heart rate, such as brisk walking, swimming, cycling, and even dancing. The greater our endurance, the greater our participation and independence in our daily routine, such as grocery shopping, going up steps, and doing household chores. Exercises also improves balance. As we get older, we have a higher risk of falls, which can prove to be potentially disastrous for maintaining independence. On top of that, we take much longer to recover from falls. So anything that helps prevent falls in the first place is extremely important. Tai Chi is quite popular. It has been shown to prevent falls and has a positive effect on balance, and among other things like improving blood flow and increasing our mental capacity. So it's worth giving it a try. Exercise also benefits our mental and social well-being. The mental health benefits of exercise are nearly endless. Exercise produces endorphins, which most of you know as the feel-good hormone, which acts as a stress reliever. It boosts our mood, increases concentration skills, alertness, and self-esteem. Regular exercise also helps in reducing anxiety and depression. So as mental health and self-esteem improves, social relations may also improve with exercise. One may more likely reach out to others due to their increased self-confidence. Maintaining strong social ties is important for aging adults to feel a sense of purpose and avoid feelings of loneliness and depression. Also, participating in an exercise class will introduce you to new people that share a common interest. Meeting others may be the first step towards establishing new friendships and developing a support network. So aside from group activities, one can also do exercises in the home. We'll be watching this video that shows some simple strengthening exercises that can be done at home. In fact, as the video plays, take a break from sitting and try some of them and see what you think.
There's an underlying myth that falls are an inevitable part of getting old. The surprising truth is our risk of a fall decreases with this one simple thing: exercise. You see, starting at 30, our muscles can lose up to 8% of their strength every decade. So, by the time we're 80, we've potentially lost 40% of our strength. We can help reverse this trend, though, with 6 simple exercises widely used by physiotherapists to keep us mobile and independent as we age. All you need is a steady support, sensible shoes, and a little time each day. Exercise 1. Heel raises. Stand tall and hold your support. Then lift your heels off the floor, taking your weight through the front part of your feet. Hold this position for 3 seconds. Then slowly lower your heels to the floor. Repeat this 10 times. Exercise 2. Toe raises. Stand tall and hold your support again. This time, raise your toes, taking your weight in your heels. Keep upright and don't stick your bottom out. Hold this position for 3 seconds, then slowly lower your toes. Repeat this 10 times. Exercise 3. Heel toe stand. Stand tall sideways on your support, with one hand on your support. Now put one foot directly in front of the other to make a straight line as shown. While looking ahead, take your hand off the support if you can and balance for 10 seconds. Take your front foot back to hip width apart and place the other foot in front instead. Balance again for 10 seconds. Exercise 4. One leg stand. Stand close to your support and hold it with one hand. Now balance on one leg, keeping the support knees soft and your posture upright. Hold this position for 10 seconds, then repeat on the other leg. Exercise 5, heel-toe walking. We'll be walking forwards for this one, so use a support like a sideboard. Stand tall with one hand on your support. While looking ahead, place one foot directly in front of the other, so your feet form a straight line. Then move the back foot in front of the other. Continue a steady walking action for 10 steps. Then, take the feet back to hip width apart. Turn around and repeat the steps in the other direction. Exercise 6. Sit to stand. Grab a sturdy chair and sit tall towards the front with your feet tucked slightly back. Now lean forward slightly and stand up. If you need to, place your hands on the chair for extra support. Carefully step back until your legs touch the chair. Then slowly lower yourself back into the chair. Repeat this 10 times. That's it. Keep these up and you'll help your muscles stay strong. If you'd like to keep these exercises handy, download our PDF. This advice is brought to you by the Chartered Society of Physiotherapy.
Okay, so if you've tried some of the exercises or even by watching them, you may find them very simple. But with repetition and velocity, they can be quite challenging, and doing them goes a long way for helping someone maintain and improve what they can. You can actually also download their booklet, which has good information about preventing falls, how to get up from a fall, and even helping someone who had a fall. Right, so I've talked about benefits of exercising, but of course there are barriers in any age to exercise. For the elderly, pain or discomfort can be a huge barrier and limits motivation. It is important to speak to someone about their pain because it can be managed through medication and physical therapy. It is also important to match a variety of exercises to what the person's needs are. So in cases where pain is a limiting factor, for example, in arthritis, some exercise options include gentle walking, stationary cycling, water aerobics, or hydrotherapy. These exercises lessen the impact on joints and therefore reducing pain while exercising. Fear of injury is also a barrier to exercise. It is a legitimate concern for the elderly. There is a cycle where a fear of falling and injury causes a lack of physical activity, and this contributes to a decline in muscle strength and balance, and therefore increases the risk of falls and injury. This is a dangerous cycle, and to overcome, different strategies can be put in place, like appropriate equipment, assisted devices, and balance and strength training at home or with a therapist. It's helpful to start the exercise program slowly and avoid overdoing it in the beginning to build confidence. Also, warming up and cooling down before and after exercising helps prevent injuries as well. It's really important that the fear of injury does not become the rationale for not exercising. So cognitive decline. Those who are experiencing memory loss or cognitive decline may not remember or comprehend exercises. This doesn't mean that those, for example, with Alzheimer's shouldn't exercise. Physical activity is of great benefit to people with memory loss. It also decreases agitation and wandering and may even slow the progression of the disease. This is because exercise maintains blood flow to the brain and may stimulate brain cell growth and survival. When a loved one has Alzheimer's disease, their exercise routine may need to be modified to keep them safe. This can be done by incorporating activities into their daily routine. Simple exercises include walking, climbing stairs, and simple stretching. Repetition of an activity may also be a key for those exercises to become a habit. Loneliness is also a huge barrier to overcome. If your loved one has lost a spouse or their friends or their partner is physically disabled, they may lose their motivation to stay active. Most people, not only aging adults, are more successful at an exercise program if they work out with a partner or in a group. There are plenty of group fitness classes options out there, or you could even start one with your family and friends. Someone mentioned to me the other day, one could borrow their neighbor's pet to take for a walk. And I think that's a splendid idea because pets are great and they can make someone happy and motivated and all. But just make sure it's not something huge because they might be the cause of falls. Or bring your neighbor along, even better. Sorry, going back to the previous slide. A person's lifestyle's behavior can also be a barrier to exercise. Some people just prefer a sedentary lifestyle to begin with, such as reading on the couch, watching television on the couch. But as most people know, recent studies show that even if we get the recommended amount of exercise each day, which is about 30 minutes of moderate intensity exercise on most days, our health can suffer if we sit down for the rest of the time. So aim to be physically active every day. Older adults who have led a sedentary lifestyle can definitely benefit from beginning a regular exercise program, even if they start at the age of 70 or 80 or even older. Also, it is helpful to identify physical activities that they find enjoyable and are self-motivated to do. Set achievable and meaningful goals. So one person might find it meaningful to play with their grandchild on the floor, but they need to get down and up from the floor in the first place. And believe me, it can be quite challenging as we get older. Others may find meaning in working in the garden. And that also involves kneeling, squatting, reaching, and all that takes quite a bit of flexibility, strength, and endurance. So yes, remembering these goals may help someone to be motivated to do their exercises. So just to wrap it up, exercise is important. Be active every day in as many ways as possible, doing a range of physical activities. It's good to incorporate all like strength, flexibility, balance, endurance all together. And it's important to stay motivated. So as I said before, set realistic, meaningful goals, choose the activities that you find interesting, and exercise with family and friends. Also, remember that one size does not fit all, especially when there can be the complexity of a medical history like chronic diseases and neurological conditions. See a health professional if you're unsure where to start. So what extra are you going to do tomorrow? Thanks for listening, and I'll pass the time back to Dr. Chong.
Okay. Thanks, Jean, for teaching us the importance of exercise. So yeah, I'll whiz to my slide due to the lack of time, but I'll make my PowerPoint available for those who want to have it. Proverbs 10:13 say, "On the lips of him who has understanding, wisdom is found." Now, wisdom is the ability to apply knowledge in life's different situations. So we have not stated that active stage is a stage where we care for one another, grandparenting, travel, volunteering, sports, recreation, and learning new things. Just let me say one thing quite clear. Not everyone will live a long life, but everyone can live a full life. And during the recent GMC, our speaker mentioned these 5 American missionaries who in 1956 was speared to death by the Wadani, Indian tribe in Ecuador. The age from 27 to 33. If you want to watch a movie, what happened after that, go to YouTube, look for End of the Spear, and you'll be able to see what happened after that. So are we prepared to live longer? Briefly, everything we do is based on the choices we made, and we are the person who is responsible for the decision that we have made. Proverbs 3, Ecclesiastes 3 verse 11 said, there is a season for everything. During our lives, we need to make choices and decisions, such as what we believe, our career, our family, health, finance, and leisure. And there are many types of transitions, from a child to adulthood, from caregiver to being empty nesters, and also from single to being married to widow, being a caregiver, and also codependent with our spouses, and being a carer and being a recipient of care. So in these situations, there are many transitions that we meet in life, but also there are situations where we need to make informed decisions. The Bible contains words of wisdom that we can use to apply in life's different situations. And one thing we can learn from our seniors. This is one example from Mother Teresa. If we want to change the world, start with loving your own family. If you want to love, we need to learn how to forgive. And some people enter our life as blessings, and others enter as lessons. And Tony Campolo, a professor of sociology, he actually did a survey of 50 people, 95 years and over, and he asked them this question: if you could live your life over, what would you do differently? There are many answers, but he summarized them into three major ones. Firstly, they will reflect more. They will think about what's going on and live along well thought out priorities. They will contemplate the meaning of life, family and work, etc. Secondly, they will take more risks. Now, if they can live their life again, they won't be so scared to take risks. They would have developed courage to venture out of the comfort zone. And the comfort zone can be defined as a beautiful place, but nothing ever grows there. You can apply it to our personal life, you can apply it to our family, even apply that in our church. Taking risks, those of you who are Star Trek fans would know the mantra, go where no man has gone before. You can't have friends or care without risk. You can't engage in a marriage relationship without taking risks. You can't have fulfilling career or purpose without risks. Faith, in fact, someone has said, is spelled as risk. And William Carey said this: expect great things from God, attempt great things for God. And thirdly, they said they'll do things that will outlast them. They wanted to know their lives counted for something, that long after they left this world, somehow the impact would live on. We can learn something from these people about setting goals. How then shall we live as we grow older with wisdom? And Ephesians 5 admonish us, look carefully how you walk, not as unwise, but as wise, making the best use of our time, because the days are evil. And Chuck Swindoll once said that, life is 10% what happened to you and 90% how you react to it. Basically, he said, you have no control on a lot of things, what happened to you. The only thing we have control is our attitudes. And this is just a slide to summarize that there are many things. Adversity, we have no control. COVID-19, the rise and fall of share markets, we have no control other people's actions, their opinions, their feelings, their mistakes. But one thing we can have is control of our attitude as we age. And from our attitude comes our effort, behavior, and actions. So I've just listed down 6 biblical reflections that will help to shape our attitude in aging. Firstly, we are created in God's image. We are saved by grace to do good works. We are blessed by God to bless the nations. We are in the world, but not of the world. And we can finish well, leaving a legacy to others. And our aim in this life is to please God. Firstly, in his image. We are created in God's image to have a relationship with God and others. And from that, we can derive our values. In all that we do, we can demonstrate compassion, accepting people as they are, bringing to each and love and tenderness of Christ. Justice, treating all people with fairness and equity to transform society. Integrity, acting with honesty and truth, ensuring who we are enable others to flourish. And excellence, excelling in all aspects of our healing ministry. Now, this is a slide I actually shared with the doctors in one of the journal club. This value is actually the values of my former employer, St. Vincent's Public Hospital. We are saved by grace to do good works. Now we are created in Christ Jesus for good works, which God has prepared for us to do. And the purpose of good works is so that people can see our good works and give glory to our Father who is in heaven. And we are to persevere and not grow weary in doing good works. And what is good works? Just to name a few: caring for those in our spheres of influence. And Sunny Philip, our global partner, say, as long as you ask a person, how is everything? Would you like to talk about it? We are beginning to show care to others. Volunteer in community hospitals and churches, walking alongside those who are vulnerable and hurting, and faithful stewardship of God's giving resources and care of creation, and advocacy, speaking for those who don't have a voice to speak. We are blessed to bless the nations, and we don't have to go to another country to bless the nations. Look at your neighbors to your right and to your left and across the street. You just have to open your door and go outside or to invite your neighbors in so that they can come to know Christ, grow in Christ, or proclaim Christ. We are in the world, but not of the world. And we are reminded that we are foreigners and exiles on this earth, and we are citizens of heaven. And therefore, Jesus said, don't store up for ourselves treasures on earth. Rather, store up yourselves treasures in heaven, and to seek first his kingdom and his righteousness. And leaving a legacy, this is a verse that is passed on by someone who is my mentor. When I'm old and gray, do not forsake me, my God, till I declare your power to the next generation, your mighty acts to all who are to come. We just recently started on the book of Job, and this is the last verse in Job. Job died an old man and full of days. In fact, after his trials and suffering, God added to him 140 more years and gave him 10 children, and he lived long enough to see 4 generations. You can imagine the story he told his children, grandchildren, great-grandchildren about the sovereignty of God and the lesson he has learned. And in New Testament, there's a verse that is similar to the one in the Psalm. It shows us the importance of passing on teaching and wisdom to the next generation. We involve in one-to-one discipleship, and also there are grandparents at Cross Culture who are investing in the next generation, helping young parents in the bringing up of their children and so on. So wisdom from the oldest all, we just finished a series from 1 John, the Apostle John was nearly 90 when he wrote those words, and these are words of wisdom that we can treasure. And the last verse, when he say, I have no greater joy to hear my children are walking in the truth. So one of the GMC speaker said in one of his sermons, he said, when I come to the end of my life, I will look backward. I will consider my life to be wasted until I can recall a loving family, an investment in the lives of people, an earnest attempt to serve the God who made me. Nothing else makes much sense. So there is the words about us in cross culture who are growing older together. These are men of Issachar during King David's time. There are 200 of them. David had a lot of skilled men. Most of them are warriors, but these are men of wisdom. Something we can follow, learn from them. They understood the time, what's happening. They knew what the nation should do. They were leaders together. They were with their families, and what a wonderful church if the people who are aging can learn to do things together like that. There are many things that wouldn't change this world, and every generation need to be taught what is important and how to live well. And following Jesus is demonstrably the best way to live in relation with God and one another. So this is again a psalm of a prayer of Moses, where he said, by reason of strength, we can live to 80. So remember to do our exercise. As we get older, remember to remain humble and teachable, and to get a heart of wisdom, which God can give each one of us. And also, when I'm old and gray, remember to pass on wisdom to the next generation. And in all our lives, may it be our heart's desire to please Him. So this is a summary, what I can understand. Just two thoughts of a young old and old. And I'll pass the time to Dr. Maylaw to speak about caring with understanding. Thank you.
Thank you, Dr. Chong. Good afternoon. I hope you're still able to concentrate. It's been more than an hour. So bear with me. I will be speaking to you today about accessing aged care services and caring for the carer. I am trying to move my slide. Okay. Sorry, I can't move my slide. I'm just trying again. Okay. So the first part of my talk will focus on how to access help and specialist services. Then I will move on to various aspects of carer stress and supports for the carer. And finally, I just wanted to touch briefly on what you can do to plan for the future and to give you a list of some special resources. Sorry, Sandy, I might need help with the slides. I can't seem to move it. Thank you. So how do you access help in the community? So the starting point in accessing government-funded aged care services is via My Aged Care. Some common services available include Meals on Wheels. Sorry, Sandy, can you please click on this? Some common services include Meals on Wheels, personal care or help with medications, allied health services like physiotherapies or occupational therapies, home help like cleaning or gardening,
home modifications for your safety or care needs, like bathroom rails, shopping assistance, or respite and residential care services. Next slide, thanks. Next, I'd just like to play this 1-minute video about the My Aged Care service.
My Aged Care is your starting point to access government-funded aged care services. Whatever your situation, specific needs, or background, we can help you understand what types of services are available. From services that help you live independently at home, to short-term care that helps you get back on your feet, to moving into an aged care home when you can no longer live at home. Once you have the information you need, you can call us to discuss your needs and find out if you require an assessment. If you do, an assessor will come to your home for a face-to-face assessment to work out what services you're eligible for. We can also help you estimate the fees you may have to pay and what service providers are available near you. Wherever you are on your aged care journey, My Aged Care can help you get started. Find the help you need with My Aged Care. Go to myagedcare.gov.au or call 1800 200 422.
Okay, the next slide. So how does it work? Yeah, I'm not sure whether, yeah, okay, that's fine. So after contacting My Aged Care, if you require an assessment, you will be contacted by your local aged care assessment service. The assessor will determine what your care needs are, and they will allocate the appropriate package approval that suits your needs. So the Commonwealth Home Support Program is the entry-level support. Then you have the Home Care Package Level 1 and 2. These are for people who have low care needs at home. The availability of these packages are much faster. And next we have the Home Care Packages Level 3 and 4, which are high care needs for people who have high care needs at home. However, between approval and package allocation, it may take a few months, sometimes 6 to 9 months. So these are financial packages. You can choose your own service provider after you get allocated a package. Yeah, you can also access respite through the home care package or apply for residential respite. The Aged Care Assessment Service also does residential care approvals. So essentially, no one can access any of these services in Australia without an aged care assessment. Next slide, please, Sandy. So next, I would like to take you through some of the specialist assessment services which are available. So the CADMS, or the Cognitive Dementia and Memory Service Clinic, is a diagnostic clinic. It's mainly for diagnosis of cognitive impairment and dementia. Then we have the Continence Clinic, which is a diagnostic and management clinic for problems of urinary and bowel incontinence. You may be able to access the Continence AIDS Payment Scheme through this service. Then we have the Falls and Balance Clinic. It is for patients who fall over a lot. At this clinic, you will get a comprehensive assessment of your falls risk and how to reduce it. It may include a home assessment with a physiotherapist or occupational therapist. These three are the main clinics. Some hospitals will also have a wound clinic and a general geriatric medicine clinic. All these clinics are available or should be available through your local health service, which is your local hospital network. Next slide, please, Andy. So how do you access, sorry, going back one slide, yeah. This is, Apologies for these technical problems. Okay. Now, how do you access these specialist assessment services? You can access these specialist clinics through your general practitioner. A referral is usually required. Clinics at the hospital are usually bulk billed. However, there may be a long waiting list at some clinics. Alternatively, your GP could also refer you to a private geriatrician for an assessment, although access to allied health services may be more limited. Next slide, Sandy, thanks. So next, I'd like to move on to talk about carer stress. Carer stress is common. It's important to recognize it. It is probably an understatement to say that being a carer is physically and emotionally challenging. Some of the physical challenges include assisting with personal hygiene, cleaning, shopping, cooking, assisting someone with transfers and their mobility, and keeping up with appointments and medical issues. However, the emotional toll on the carer could be worse than the physical challenges. Being in the carer role changes the relationship with your spouse or your parent. It can be very lonely and isolating. It can be difficult to find time for yourself as you're unable to leave the elderly person unattended. You might be worrying about making the wrong decisions for someone else. You may have to give up your job to care for the elderly person, and you may face difficult financial challenges. You may also face conflict from other non-carer family members who may have different opinions to yourself about how to care for the person that you're caring for. At the same time, you may be experiencing emotional distress from witnessing the health and mental deterioration of your family member. And for those who have your own children to care for at the same time, it can be extremely stressful. So what are some of the symptoms of carer stress? The carer may be feeling stressed, angry, or frustrated. They may have a change in their sleep patterns, change in their appetite, and they may also experience feelings of anxiety and depression and feelings of guilt. Other than that, they may also have physical symptoms, symptoms like indigestion, lethargy, poor concentration, heart palpitations, and a tension headache. Some may also turn to alcohol and drugs of dependence to cope with their stressful situations. Now, carers may not recognize their own stress. So if you notice any of these symptoms in your family or friends, it's important to assist them in getting some help. Now, some advice to carers. It is important to care for and be kind to yourself when you're looking after someone else. Remember to eat healthily and exercise regularly. Keep in touch with your family and friends or connect with other carers. Organize some respite, in-home or residential if possible, through carer support organizations or a home care package. It is okay to request for and accept assistance from others. It is okay to say, I am not okay when things are not going well. See your GP if necessary. Counseling is available for carers. Now, for those of us who are not in the carer's position, it is important to remember to support the carer and not just the person being cared for. It is also better for the carer and the person being cared for to be supported by a community than just a few people. However, sometimes carers may need professional support. Now, I have listed some resources for you. So the one that I'm most familiar with is the Alfred Health Carer Services, which is a great resource for carers living in the Southern Metropolitan Region. All these resources I've made available on a document for you, so you don't need to copy them down. If you don't live in the Southern Metropolitan Region, Carers Victoria is a statewide not-for-profit organization which supports carers, and they offer the same sort of services. And I have also just become aware of Carer Gateway, which is a new government initiative for supporting carers. So this is more of a national website to direct you to local services. Now, all of these organizations will be able to provide, it has just jumped back. All of the organizations are able to provide counseling, practical advice, and support groups for carers. I need to go back one slide. Sorry. Go back one more, Sandy. Sorry. Yep. So now a special mention regarding caring for someone with dementia. Caring for someone with dementia can be extremely stressful. The person with dementia may exhibit challenging behaviors as the disease progresses. This can present as aggression, agitation, personality change, being inappropriate socially or even sexually sometimes, refusing food and drink, and refusing their care, including medications. It can also be very challenging trying to communicate with the person affected. They may have poor understanding of what's going on. They may have lack of insight into their own issues, and their forgetfulness may make it necessary for you to repeat your instructions multiple times. And if they have a hearing or vision impairment, it makes it even more challenging as it adds to their confusion. And sometimes the person with dementia may not even recognize their own family or friends. Then there are the safety concerns. Some of the common safety concerns are around wandering out of the house and getting lost, leaving the gas stove on, leaving the door of the house unlocked, not using their walking aids and falling over, driving dangerously, mixing up their medications, and being vulnerable to financial scams. Now, if you're caring for someone with dementia, I'd highly recommend contacting Dementia Australia, which used to be Alzheimer's Australia. It doesn't matter which type of dementia the person has. This is an excellent organization providing support, information, and education for the affected person, carers, family, and friends. There are also online and on-site workshops for a range of topics related to dementia care, and they can also support carers as well. Now, just to touch a little bit on planning for the future, as life is unpredictable as we know it. It is important to discuss the future and have conversations with your spouse and family about what your preferences may be if you were to lose the ability to make decisions for yourself. These are mainly decisions about medical treatment, finances, and lifestyle choices. You may or may not choose to formalize the process about who makes decisions for you or what sort of choices you would make if you were in that situation. However, it will be emotionally easier for the carer if they know what your wishes are. Now, legally, you are able to make an advanced care directive. Just briefly, an advanced care directive is a legal document with instructions about future medical treatment that you might accept or refuse. You are also able to appoint a medical treatment decision maker. A medical treatment decision maker is someone who can make medical decisions on your behalf when you lose the ability to do so. You can also appoint an enduring power of attorney, which is someone who can make personal or financial decisions for you when you cannot do so. Alternatively, you may choose to appoint someone to support you in making your decisions. The details of all this is sort of outside the scope of this talk due to limitations of time, but for more information, you can refer to the Office of Public Advocates website. There is a section on Plan for the Future. Their website will give you all the details about the above appointments that you can make. Alternatively, you can speak to your GP or your legal practitioner about this. And remember that it is also important to have your will ready. Now, I'd just like to touch briefly on some special resources. The first is about elder abuse. If you are concerned about yourself or an elderly person being abused physically, emotionally, or financially, you can contact your GP or you can call Seniors Rights Victoria. Seniors Rights Victoria is a confidential service and they are familiar with managing these sorts of situations. So I just wanted to add this as a resource for you in case you're in that situation. Another special resource is the Center for Cultural Diversity in Aging. They have multilingual resources to assist people with language barriers so that they can access healthcare resources in their own language. And lastly, for people who are suffering from vision loss, Vision Australia can provide you with the appropriate support and services to help you to adjust to different ways to manage your daily tasks with the vision loss. So as I've said, I've listed all these resources for you in a document. You can obtain this from the organizers after the event. I will now pass the time to Lucien for the Q&A session.
All right, thanks, May. So we have a couple questions that come in and some of the panelists is ready to answer your questions. So why don't we start with Dr. Chong? So Dr. Chong, there's one question that asks, so you talk about and shared the popular definitions of being old as unproductive and no economic values. In some way it's true. How then should we think and act so that we grow graciously? We talk about passing our wisdom to the younger generation, but what if they are not interested in them? So I'll pass the time to you, Chong.
Okay, I think you can hear me now. Thanks for that question. As I show one of the slide, is 10% happen to be, we have no control in that one, but we have control on our attitude. And I think that's very important. From a biblical perspective, God values us because he created us. And I think that's very important to start there. And also we have, if you look at society today, most of the volunteers who deliver Meals and Wheels are involved in community, they're aged between 65 to 80 because they're the ones who are not engaged in full-time work. And if you take away that, it will cost the government a lot of money for others people to do it. So that is how I react to it. Yep. If other people think that I passed my use by date, God says, no, following Jesus is a lifetime of effort. And I think that's important to know. The other thing is passing wisdom to the next generation. Well, it is our desire that the next generation, including our children, is that they follow God, but each of them have got a choice they have to make, particularly with their beliefs and their values. We can do our best to teach them, and hence it's so important to teach them when they are young. And we are thankful to God. Most of the children who go to our kids' church, by the time they become young teenagers, most of them have made the decision to know Christ, to grow in Christ, for which we are very thankful. But if they make the choice to show no interest, as parents, we can pray for them and continue to make ourselves available to show our love and concern to them and be an example to them. As I said, we can learn from our seniors. Now, Dr. Billy Graham, who's a well-known evangelist, passed away a couple of years ago. Go to Christianity Today and look at some of the tributes from his children, because some of them make what you can call poor choices. But look at what they learned and how God, by the grace of God, how God has used them, despite making unwise choices, you may say, but learn from that. So be encouraged and continue to pray and show our unconditional love to them.
Thanks, John. All right, and we are moving on to the next question. If no one wants to jump in to contribute. All right, I'll take silence. Let's move on. All right, for you, Dr. Melvin Yong. So there's one question coming from Lena. How do you motivate a 90 years old to stay positive and want to live? So this is open to other panelists as well, but Melvin, you can start first.
Yeah, by all means, if the others would like to chip in, that's very much welcome. I put my hand up for this because it's a topic that's very dear to my heart. I'm close to my grandmothers because my grandfathers died a lot younger when I was a lot younger. One died at 88. One is still, the last remaining one is still alive, and she is towards the middle of her 90s. And she has had a couple of heart attacks and starting to become frail, and quite a lot of the other issues about aging that I mentioned earlier. So, I probably speak from that position because it's something which our family had to deal with. And the other thing which I think as a lot of doctors and us geriatricians have encountered in our practice is also the rather somewhat common scenario where someone in their elderly age, we find out about a new, or we diagnose a new life-limiting disease. It's almost always cancer, right? In those kind of stories. And there's often this a bit of a ethical and emotional debate between families, patients, and ourselves about whether do we tell them about it or not, because if we tell them, they're going to become depressed, they're going to lose their will to live, and that kind of scenario. So I probably come from that position, and of course I can't speak on your behalf because everyone's story is different. But I probably would want to challenge the question and ask why. Is this going to be the biggest question? It's going to be the biggest question. I mean, it's going to, and in fact, actually, we'll probably, and forgive me for asking this, but it probably will challenge quite a bit of your own motivations about it as well. Of course, I probably imagine that it all comes from a good place, that you just want people to be happy. But as how Sam mentioned in the service earlier this morning, I think we probably do it's us doctors included as well, that we do a very bad job by actually listening to people. And I think probably the first place I will probably start is actually going to have a proper sit down. And probably not just one, but probably across some time as well. And actually asking about, things are different now compared to before, but how do you actually feel about living longer, and what do you define as what your quality of life and what happiness is for you, because that changes with age. I can say my happiness as when I was 15 was a lot different to what I am now, and I think that will be the same when God permit that I get to 90. That will probably be the same as well. Of course, I mean, I want to make a big distinction as to whether there might be the possibility of other mental health issues like major depression, which is totally different kind of fish, big topic in itself. But if we're just talking about some general kind of things, I probably would actually start there actually, and then probably question some of your own, motivations and desire about it as well. So I hope that helps. I'm not sure if anyone else might want to jump in.
Anyone from the panelists want to help out as well with the question? It's a tough one, isn't it? All right, thanks, Lena, for your questions. And now let's see which one would go next. All right, for one of the questions, is it okay for 65 years old plus to do cardio exercises such as walking briskly or even jogging so that you end up puffing and sweating? So is it okay? Jean might be your area.
Yes. It depends whether you have other things going on, like heart disease, or if it's just in general. Yes, for all, it's really good to go for cardio exercises. I think the term moderate intensity exercise is defined as you can still talk when you're exercising. So yeah, puffing and talking, but you can't sing the words to a song. That will be considered vigorous exercise. So I guess for if you're going to do jogging or brisk walking, or some people can even run, just make sure you're not exercising to the point where you can't maybe sing a song. Maybe that's a practical way of putting it. But yes, if you're able to talk and puff at the same time, go ahead and do it. I hope that answers your questions. Good question. Thank you.
And I guess just from a doctor's perspective, is also, of course, as Jean rightly mentioned, if you do have other medical history that's of concern, especially heart-wise, then it's never too harmful to consult relevant professionals. If anything, I do recommend the heartfoundation.org.au website, because it does offer quite rather, let's call it general specific advice about exercise after heart conditions, and they will have a quite number of different sort of things being addressed there as well.
All right, now we still have time for one last question. So this question is open to the floor. Thanks for sharing important points about the changes of aging. So is aging a disease? If it is there a pill to reverse or slow aging process?
I think personally, there's not, if you're talking about a pill that will slow down aging, probably not. There are a lot of people claim that there is a pill can slow down aging or anti-aging, but they're very expensive. But we do know exercise does help a person to live longer, so concentrate, and that is it only costs you your time and your effort. I think that is a good thing. And the other thing is be active as possible. When you're over 65, keep learning and keep humble. And also, we really need to guard our hearts against pride and cynicism. I observed quite a few well-known Christians, but near the end of their life, they really become quite cynical, and some even abandon their faith, which is really sad. So I think be humble, be teachable, and as we age, in the sense of the word, as I said, not everybody will live a long life, but everybody, by God's grace, can live a full life as long as they live.
And I guess just to add to that as well is that I probably want to go back to your initial question, is aging a disease? Which is a very interesting question in itself about what actually disease actually means actually. And before, I don't want to go into the whole details about it because I can happily spend an afternoon talking to you about it, if you so wish to. But I'll probably start by, just to make it simple, to say that I think with something like aging, all the problems that come along with it is not just what happens within our body itself. As I sort of mentioned about aging, is that it's not just physiological aging. There's obviously your own psychological health and your perception, and not to mention how society perceives old age and how they react towards it in terms of how they react to an elderly person on a day-to-day basis, or even up to national health level policies that affect it as well. So obviously, I think aging is not something you can just put down to just purely just a disease, because if aging is a disease, then there's a lot of things that can be classified as diseases: obesity, social inequality, and income inequality as well, because we know all of that can, cause disease or make it worse or make it harder to treat as well. So it's an interesting question, one which will probably carry a lot of debate. There is a lot of research into what we call anti-senescence, or sort of investigating and trying to reverse the biology of aging. And I suppose there's a big international and somewhat wide cry to make aging a disease, partly because it actually helps to draw more funding from governments or from public corporation or private corporations to research into it. Then again, my flip side to that is, why do we need to make aging a disease in order to actually attract all those kind of resources to begin with? Don't forget about your rights.
Thanks, Melvin and Chong. Okay, so we have one more question. I think, May, this will be your area from the talk that you had just now. So some of us coming from Asian background have the mindset that if we send our aged parents to nursing homes, even one who has prolonged multiple chronic conditions that require high level of care, we will then be labeled as unloving children. What do you think about this?
Yeah, so my response to this would be that it's not useful to put everyone in the same basket. Asian background could represent many different cultures. Asia is very large. Every family has different dynamics. Even some people in the Western culture has difficulty putting their parents in a nursing home. So I think it depends on the individual situation, and that everything else has to be taken into account. Each family's financial and caring situation, and whether it's actually safe to remain at home. I think that's the main point. If it's no longer safe and care cannot be provided adequately, then it might be better to move that person on to a nursing home. So yeah, we just cannot generalize whether it's Asian or not Asian. Yeah.
I think one of the issue is having worked so many years in aged care. One of the things as a geriatrician, you actually see someone who taught you in university. I've been working 33 years, and May and Melvin 3 years, but you will do that in about 25 years time. So I saw an anxious lady with the daughter a couple of years back. When I approached them, they both looked very anxious. But when I saw her surname, I asked her, is she related to my professor in university? And both of them breathed a long sigh of relief, because there's someone who remembered the husband and the father who taught him. And straight away, it's a very friendly conversation. He told me the professor's got advanced dementia in the aged care facilities. But what I found out that out of the 4 children, 2 are professors in university in the USA, in California. and one is a professor of law, and their only son is in Perth. So it really shows you with globalization, your own children may end up in four corners of the earth, and that's a reality that we need to know. And the other thing is that people appreciate acknowledgement or someone who remembered them. That's two of the things. And also, now Asians living in Australia is in a different situation. So my view is be willing to adapt to changes in situations. And you may be accused of being unloving if mom and dad need to go to aged care facilities, but don't forget, a lot of the carers at their age have got back problems, and to care for someone at home, it's not practical in that sense of the word. Thank you.
Thanks, May and John. All right, we have one question that coming through with the topic of dementia. So many people fear getting dementia as they age. And what are the early symptoms for dementia, and what point should one be concerned and to get tested?
Yeah, so I can take this question. So I think it's when the memory impairment starts affecting your daily function. It could be quite common to have a bit of forgetfulness as you get older, and it's hard to tell whether this is dementia or not. But when it's really impacting on your daily life, starting to make it really stressful for you in your daily life, then you should get tested. And getting tested basically involves us doing a range of blood tests to make sure that there's no medical causing the memory loss. We also something else going on, like a stroke or a tumor, for example, in the brain. And we do a memory test to begin with. Even if we don't find anything, it's useful to have that comparison later on if that person deteriorates. So I think it's important to get tested early, because there are things that we can pick up that may be affecting your memory, that may not be dementia. If you go and see a geriatrician, we will also review all your medications to see if the medications are appropriate. Some medications affect your memory. For example, some medications for urinary incontinence can affect your memory. So when I see a patient's memory affected, I might stop that medication and then they improve. So it may not be dementia, it may be something else affecting your memory that we can pick up earlier if you come for an assessment earlier. The other thing about early assessment is that the treatment usually works better and is more beneficial for people who are picked up early. So we do have treatment for Alzheimer's dementia, which is not extremely beneficial, but it can be beneficial in some people, especially in the early stages. And if we pick up your disease early, we can also provide an earlier support to the carer so that they know what to expect. And before you lose your ability to make decisions, it's important that you can plan for the future as well, because things like appointing a power of attorney, you can't do it once you lose the ability to make decisions. So it's good to pick up things early so that help can be put in place.
Otherwise, the other slide that Dr. May put up from Dementia Australia, it's a very useful website for not just patients, carers, but just other people who are more interested in it as well. So if you do go to Dementia Australia's website, they've got a whole good ton of information in a lot of other different languages as well. So it's actually a very helpful place to go to as well. And I suppose in reply to, I think another question that was talking about Sudoku and other sort of brain things, I probably will refer you to there, because there's a whole section that's dedicated to risk reduction and certainly keeping your brain active, whatever way it is. Sudoku is just one of them, will help.
Okay. All right, we'll close our today's Q&A with one last question that's close to our today's topic. So is it safe for elderly to exercise in groups in light of COVID restriction?
I'll advise not to. Great question. In these times, I think it's important to stay safe. And there are a lot of resources out there. Like I was just typing Tai Chi Australia. There are videos that show how to do Tai Chi, and I think it's quite interesting. It's good for balance. Other things you can do at home, if you have steps, exercising up and down the steps, walking, doing those exercises in the video before. All these are helpful. Yeah, I think having someone there with you is also a good idea, or like chatting to someone on the phone for accountability, or just socializing, because otherwise it'll be hard to motivate yourself to do these exercises on your own. Yeah, so that's that question. But yeah, try to be safe and not go out in groups during this time.
All right, I'll pass the time back to Huidi to close our session today. Thanks.
Okay, thank you, Lucine. Once again, I'd like to thank all our speakers for their invaluable time in preparing for this webinar and in helping us with our learning on how we can age well and to be a better carer. I also want to thank Pastor Sandy. He's working very hard supporting us technically behind the scene. Before we close, I do have 3 announcements to make. Firstly, a recording of this webinar will be made available on our church website resource page later this week. So you can take your time to watch it again, or you can share it with anyone who has missed it. Personally, I've gained so much, and there's so much information that the speakers have shared. I definitely want to watch it again. Secondly, when you exit this webinar later on, you will see a feedback form on your screen. We would appreciate if you can take about 2 to 3 minutes to complete the form. Your feedback will help us improve and to serve you better. The last announcement is about our next event. Our next event will be held on 2nd of August, Sunday, the same time from 1:30 p.m. The topic is When Addictions Entrap. Our speaker will be Dr. Alan Gispers, and he's a specialist physician in addiction medicine. Do save the date and look out for more details. I hope to see all of you there. Now, if you have any queries about today's event or you require any other information on our ministry, please email your query to caring.together@crossculture.net.au. We've come to the end of our webinar. Thank you so much for joining us online. Goodbye, God bless, and have a great week ahead.